My Portuguese is not as good as my Spanish, but thank you still for painting a very lively picture of the complexity of decision making in Brazil, and also how different stakeholders play a role in that, and how the national dialogue involving all these stakeholders has actually helped to address many of the issues. Thank you very much. For final remarks, I go to Keith Hansen. We've been talking or trying to highlight, really based on national experiences, how sharing of experiences can help within country, across countries. Do you want to draw some final conclusions for this?
Thank you. And I know time is tight, so I will be brief. First of all, thank you all very much to the participants and everybody for attending this, and to WBI and PREM for hosting it. I think this has been a wonderful series and initiative on the part of WBI and all the countries involved in it, because this is clearly a pivotal issue for both Latin America, but also increasingly the world as a whole. Just a word of context to remember why this is important. Economists have an entire toolbox of things to do to address market failures. Taxes, mandates, transfers, public provision, information, whatever it may be. The toolkit is considerably more limited in response, however, to political failures. And this is where rights arise. And a generation ago in Latin America and at other points in other parts of the world, a rights revolution took place in response to the flowering of democracy and a conclusion by the populace that the political system had failed to deliver on an equity agenda. And this is really what has brought us here today, is a sense that political failure that cannot be resolved merely through cost-benefit analysis or through traditional workings of political mechanisms in the countries. This is enshrined in constitutions, and it is therefore a legal mandate on the courts, not just a legal nicety that they can choose or not choose to address. And this really brings three different worldviews into contention with one another. The health professional wants to achieve the greatest health for the greatest number. The economist wants to achieve the greatest health at the least possible cost. And the judiciary wants to ensure the full vindication of rights for all at minimum cost to the rights of others at the same time. And it is much of the time impossible to reconcile all three of these in any a priori fashion. So this is always going to be work in progress. It is always going to be an incremental process of trial and error, which is precisely what is going on right now. And I think that's why this inter-country and global learning exercise is so important. No one is going to get this right the first time. No one is ever going to get it right for a final time. And every country has to start with its own set of starting conditions and values and situation. I think many of the advocates of this approach look to the kind of disparities that Amanda put up there and said, yes, vaccine rates are very low in many countries, but that is not simply because countries are spending money on expensive treatments for other things. Vaccine rates were low even before there were these expensive treatments available. There's something else going on there, and it's incumbent on the system to begin to pay more attention to people across the spectrum in terms of their health conditions. I think there's also a sense that using health spending as the denominator may be too narrow a focus. And we heard a bit of this from our colleagues from Costa Rica, that the mere cost of something should not determine whether or not it is a right. I remember early on in the movement to raise global access to antiretroviral drugs, the arguments were made this would cost billions of dollars a year, and health systems are only spending X amount. But at the same time, that could have been seen as an argument to spend more on health in aggregate. Mexico and Seguro Popular did not just create a new system of health insurance, they also raised by 1 or 2 percentage points the share of GDP that is going to the health sector. So part of this, I think, is a signal from the populations of countries that have enshrined these rights that they want to see a larger share of the public effort going to health sector and health sector investments. Now, none of this, of course, answers the question of how to attain the greatest value for money, and that remains an inescapable question in any system. But I think it does explain some of the complexity of what brings us to this. So what comes clear, I think, just from these 2 or 3 presentations, as well as the larger series, is there are a series of choices that every country is facing, and that each of them can stand to teach and learn from one another, as well as the supporting institutions. One is that trade-offs are inevitable. everywhere. This is an axiom of economics, and it's a simple statement of fact. But the question is how explicit those trade-offs are going to be. And I think the concern in many countries around the world has been that the trade-offs have often been, as Amanda said, ad hoc. They've been implicit. They've been altogether invisible, and they've been made according to no external criteria, whether cost-benefit or rights-based or a simple approach of accepting whatever is new. And part of this initiative is helping to make more explicit what the choices are, what the trade-offs are, and the costs of these things. And I think part of the effort, the contribution that outside organizations can make in working with countries is to help make the trade-offs clearer. And each country can come forward with its own experiences to say, all right, this is what we're learning about how these choices are made. Who has the right to make them? Which actors should be at the table? What is socially acceptable in any country? What criteria do they use to do so? What is going to be resonate the most with the values in our society? And at whose cost will this be? Will it be purely in the public sector? Is it to be shared through a public-private alliance? Is it going to be tripartite, as in many Latin American countries? But the sheer raising of the profile of this and the mandates coming from the courts are forcing now a more explicit conversation than often happens in many countries. At the same time, this is also revealing how crowded and complex is the playing field in the health sector. The headache, the nightmare that health specialists and economists have been enduring for years in this is now becoming the headache of the courts as well, as they begin to see just how crowded the landscape is, how many different interests are at play, and how many of them are actually conflicting or contradictory at any point in time. And there is no single settled optimum point one can reach in any of this approach. And so it is a constant series of incremental improvements and movements. And third, I think in many countries, in some of the earlier conversations we've had, it's clear that the courts don't wish to become involved in retail decision-making at the individual level on this treatment or that one month after month, but they feel that there has been a systemic failure to address these issues in a more logical and explicit way. And so their involvement may be seen as temporary but transformational in forcing government and society to have a more honest conversation with itself about what is going on. And so I have no insight or conclusions on what the right answer is, because I don't believe there is a single right answer. But what's very clear is, given the complexity of this, the many contesting interests, the many competing kinds of experiences going on, the more that we are able to share them openly, the more that the different branches of government are able to discuss among themselves and across country lines, and the more that the different levels of government, as in the case of Brazil, are able to converse about this, the sooner countries will be able to find their way towards something that appears to be a more sustainable solution that everyone can live with. No one is ever completely happy with the state of health access or its costs, and unfortunately, because of the miracles of modern medicine, this sense of gap is likely to grow worse before it grows better. There have really been three simultaneous revolutions in the last single generation. One is the march of medical science. Conditions that crippled or killed our parents and our grandparents are now easily preventable or manageable. The second is the rights revolution itself. And the third is the increasing globalization of how we conceive of legal processes and rights. And this is where the inter-country learning is becoming so important, as countries look to one another and are much more informed by the processes of analysis that go on here. So it's a wonderful exercise, and I think everyone should feel heartened that we're having it, and not disheartened that it seems so hard to find the right answer, because that's something we will make up as we go along.
Thank you, Keith, and a big round of applause for Keith and all our panelists.